They only recently started doing that.
I believe within the last year or
Really
so.
recently started
Before,
doing
it
that.
was just
I
all
believe
lumped together
within the
with
last
kratom.
year or
So
so.
before late
It was
2025,
all
when
lumped together
and
with
not
kratom.
everybody
So
tracks uniformly, I
before
should
late
say there's some
2025, when they
places that
not
still just
everybody
track them as
tracks
kratom.
uniformly,
But when
places
places
that
that
still
still
just
just
track
track
them
them
as
as
kratom.
kratom, but when places that still just track them as kratom, but when places that still just track them as kratom, but when places that still just track them as kratom, but when places that still just track them as kratom, really, but when places that still just track them as kratom.
Okay, that's the mic aux. Mic aux is unmuted. Okay, that's the mic aux. Mic aux is unmuted. My mics are muted. Okay, that's the mic aux. Mic aux is unmuted. Okay, that's the mic aux. Mic aux is unmuted. Wait. Okay, that's the mic aux. Wait, keep doing that. Can you mute yours? All right. Did that change anything? The mic aux is unmuted, and now Ken's computer isn't causing feedback. Tinsley? Okay.
But taking responsibility, like I said, it changed my life. My wife has fibromyalgia. There's a group of people who rely on this stuff. And we have to protect the innocent from getting the bad product and hurting themselves. That's what regulations are for. And that's why we're for that.
Labeling include.
I think just explicitly saying what it is, that it's natural leaf. kratom, that if there's any risks of, we need to label if there's any risk to it. I haven't gone down what that solution looks like, but I think we need to inform, the customers what they're buying. But we could look into that a little bit more.
I'd be interested, like interaction.
I mean, we have sales teams in all of our locations who have general knowledge of the product. We try to have that one-on-one conversation to make sure that people are, they understand what they're getting. I think proper labeling would help with that. I know you raised your hand. You might be able to point to that a little bit more.
Yeah.
Yeah, just real
So
clear.
generally labeling you see is don't use unless you're 21 up. Please consult with the physician before use. Generally, don't use while pregnant type statement. List of the ingredients used in a nutrition or supplement facts panel. And a label denoting the levels of the various alkaloids in there, such as 7-OH, mitragynine. So for example, most of our labels will say like 0.001 for 7-OH and 0.8 for mitragynine. General statements of health, please consult a physician, 21 up, those types of things.
Thank you. Sorry. Oh, I appreciate it.
All right. Any other questions from the board? Catlin, anything? On. Right. Well, very good. Thank you, gentlemen, for your time.
Thanks for hearing us out today. Really appreciate it.
So we're going to be going on to some mundane stuff. You guys are,
Count for a little bit.
Oh, yeah, basically.
See how long I make it.
yeah. All right. So next on the agenda is oral and the financial report.
The mundane stuff.
It's on. Just the mic.
definitely some numbers to look at. So always like to take this meeting, thank Conan for all his work during the year. He does a great job of keeping us on track, and some of the things that he put in place last year were monthly meetings with all the division administrators. So we're tracking more closely all of the categories of our budget and really trying to pay attention if anything's getting off more than 5%, that we can be having those conversations with our teams and program managers and keeping them in line with our planned spending, or making changes to the plan if we need to as well. So you will see that our revenues ended the year at 89% of our planned budget amount. And that the big area where we were different than what we planned was in that other funding. So we received less opioid funding than we planned to for the year. So that brought us down to just 62% of what we planned to get in other. And where you see that reflected in our expenditures is our trustee and benefits. So when we get less money in that category, we're giving less out to the community to work with them in that T&B category. So we received 62% of what we planned in that other category for revenues, and then you'll see that reflected in our expenditures and the trustee and benefits being only at 75% of what we planned. So evens out pretty nicely there. The last 2 fiscal years for personnel, we've been budgeting at 97% of what it would take to fund the entire staff for the year. And that practice has turned out really well. You can see we ended the year with having spent 95% of what we planned for personnel. So even planning at 97%, we're still only spending 95% of the 97. So it's been really fiscally responsible to plan to spend 97% rather than the full 100. It's been working really well. Moving on to page 2, we can look at our comparison over the past couple of years. We did really well with our fee revenue this past year in both of our fee generating divisions. For family and clinic services, I just draw attention to our home visitation revenue, which has increased year over year, but really significantly from FY25 to FY26. So it's nice to see that jump. And the board, remember, we made some changes in what we could charge and what categories people could be in to qualify for the Medicaid reimbursement. Contract amount, we've seen over the past few fiscal years, the amount that we're getting in contracts has decreased. Those were planned things. We knew they were coming, and that's something we just continue to track. It's depending on what we get in, mostly in contracts from health and welfare. So that's where that number is reflected. And then looking at the summary of our expenditures for last year, as we talked about on the first page, our personnel ended up under budget, as did operating, T&B, and capital. And some of those costs before we did the budget revision halfway through the year, we had been over in operating, but the board approved moving some of our funds around. So we ended up underspent in all those categories by the end of the fiscal year, which is a good thing. And then the final numbers for our cash balance at the end of fiscal year 26. We ended the year at 9.8 million for a cash balance. Most of the fiscal year, we were in the range of 10 to 10.5 million. So we're back in those bathrooms, which is nice. And if the meeting goes long enough to take a break and anybody wants to wander around to those and see them, we've got the door propped open there, so you can go check them out and see how nice they look. Our personnel reserve fund remains fully funded. Operational reserve is at our 3-month reserve point. There has been no change to the capital reserve fund. That brings a total reserve fund designation of 6.1 million, 3.2 million in restricted funds, and back to that balance of 536,000 of undesignated, unrestricted for the end of the fiscal year.
I have a question.
Yes.
So with the bathrooms number, 190,000, have we made like a
Had sent in, I don't recall at this moment how much that one was. I just remember hitting the approve button on it. So there was that payment, and then there will be one more at the final completion. I don't know that it'll be that whole 190, but we didn't get approval to make any change to that, so that's what we're left with as of today.
any other question?
Yeah, I was gonna ask a question on the retention incentives. I don't remember exactly how we got that.
Okay, yeah, so for the retention incentives, that is partially funded by our Public Health Infrastructure Grant, our FIG grant is how we refer to it. And so there's a portion from that, and then the board approves the other part of it. This year, we spent more than what we planned to at the special project designation time in August of last year on our retention incentives. And that has to do with number of staff and how long they've been here. So there's the 3 levels of retention incentive based on longevity with the agency.
I swear the ringer's off. I tell you.
It's the mundane stuff, but I mean, sometimes we have a ringer on. So as staff have been here longer, we need to plan to spend more, and we miscalculated how much it was gonna cost at this meeting last year. So we had extra in some of the other carryover designated projects. So at the budget revision time, we talked about designating extra for that, or additional money for that. We think we've planned better for it this year, and we'll be asking for the board's approval to continue that as an action item on the next.
That's why I asked.
Yeah.
Any other questions on that? Very good. Then we are moving on to the action item to discuss and vote on the disposition of the carryover designations. Oral. One more time.
Okay, so just as a reminder, our reserve fund proposal, we do it in the August meeting every year. It's when we know how much we have as carryover funds from the previous fiscal year. The board approves a policy that states that we have 4 categories for reserve designation. We have our special projects, carryover projects, and those are determined by the board as appropriate. Our personnel reserve is designated for funds for the 27th pay period that occurs about every 11 years. Operational reserve is for emergency cash flow needs. And our capital reserve is for any kind of major facility related costs that we didn't plan for. Over my 6 years here, I haven't seen us need to draw down that operational reserve or capital reserve. We haven't had any emergencies that have happened that have caused us to go into those reserves. But we do ask again every August to make sure that those reserve funds are fully funded in case something were to happen. So the board has a discretion to approve all of those categories. And it was at the board's direction many years ago that we got our operational reserve up to that 3-month cash flow balance. So a little bit of background on that. So if we go to the cash balance statement, we have 9.8 million, as we just talked about for the last agenda item. We keep $2,500 cash on hand. And that's a practice that we started after Luma. If the board remembers, we had a couple of issues with paychecks being fully paid out. We haven't had that happen recently, but we wanted to have some cash on hand if staff members didn't receive their paycheck and needed something to get them through until Luma was able to fix the error and get the paycheck to them. So that's been helpful a couple of times, but generally it's just a little bit of cash on hand that we keep in case of emergency. You see a list here of our restricted committed cash. That's cash that we've received in already that's restricted or committed to specific projects or funds. So we've got our Millennium Fund, our opioid settlement funds, state home visitation, our citizen review panel, our home visiting Medicaid, and then encumbrances that we have from the previous year that haven't paid out yet. That comes up to just over 3 million, which brings our available cash balance down to 6.7 million. And then I'll jump down to the bottom of the page before we talk about the special projects and look again at those reserve fund designations. So the personnel reserve fund, last year at this time, the board decided to fully fund that. So we're not asking for any additional funds to go into that. It's still fully funded for that 27th pay period. Usually we do 1/11th per year, but since it's fully funded, we don't need to do that. Next fiscal year is when we will use that, and then we'll start building that reserve up again next 11 years after that. Operational reserve is still, we're asking to maintain that funding at the 3-month operations level, which is just over 4 million. And we're asking that the board also allow us to retain that 1 million in the capital reserve fund. Also point out that keeping the funds at that level, we continue to generate interest on them. So that also comes into our revenue by keeping those reserve funds at those levels. Okay, and that brings us to the special projects, which I always like to talk about because having some reserve fund designation to do these projects really allows us to do things differently than just what our other funds and contracts allows us to do. So you'll see that we have that capital improvement office expansion that I referenced from last fiscal year that we'd like to carry over, and that's to expand the front of the clinic. I don't know that I can describe it clearly in a way that you'll know what I'm saying, but it's just an expansion of the building out further towards the parking lot where we would have our community closet area, our community health worker, and just a bigger designated space to make those referrals for community members that work with them when they come into our building. Less than what we thought it was going to be, so we're asking for less this year than we did last year for that. Retention incentives, we have calculated more carefully this year. It's still less than what we ended up spending last year, but between the FIG money and this 185,000, we think our retention incentives will be fully funded for this year. As a reminder on that, that goes out in the first paycheck in January to staff based on their longevity. So we're asking the board to continue to support that this year. We've got the completion of the Armstrong bathroom. We moved it down from the 190 to 100,000. That should get us through those last couple of payments on the completion of the bathrooms. Excella, I have a great update on that. We've got the implementation completion. Finally, the word completion is added to the special project. So our go live date for that is August 31st. So by the time the board meets again, I have said the last couple of meetings, by the time the board meets again, we'll have a date. Not only will we have the date, that date will have elapsed and Excella will be live. So we should have some feedback for you by the October meeting on how it's going. And if anybody wants to file a permit between August 31st and the next board meeting, you'll have the experience of using Excella. So we're really excited about that. We're in our user acceptance testing phase of that right now. And then that will go for 1 more week. The week after that is train the trainer. And then we're straight into go live on the 31st. So all hands on deck right now, getting ready for that. And Curtis and his team are really testing every corner, cranny of the system, trying to figure out any. I think you submitted 40 tickets.
42 tickets
yesterday on just things where there's a phone number showing up on a permit that shouldn't, or there's not a phone number and it should. So they're just going through every detail with our live data in the system to make sure it's all looking and functioning like we want it to. So it's a lot of work. Thank you. Okay, back to our special project list. We did request, or we are requesting, $250,000 to replace the roof on this building this year. We had somebody come look at it and give us just a very high level preliminary quote. It will be about 250,000. There were a couple of windstorms this year that resulted in some shingles being distributed throughout our parking lot. So the guy who looked at the roof said it could probably go another year, if you want to push it, but it'd be smart to do it now. So we're asking for the funds to do that. We've got $25,000 in staff development, and that'll just be for a couple of trainings, one in specific. Gary and I would like to get certified to be Clifton Strengths Finders coaches and be able to provide that to all of our staff internally, the Strengths Finders assessment, and work on interpersonal or personnel issues. Just have that extra certified ability to bring a different perspective to how our staff are interacting and working together. So that would fund that for both of us and a couple additional trainings for other staff as well. We're asking again for a additional boost in our FCS marketing. We've had some successful efforts with that this year and some kind of accidental and unexpected, especially with that Idaho City Sports Physical Clinic that I think went out in a flyer. Yeah, unintentionally. So we like to be a little more intentional about it and continue to see those returns on our investment with our marketing. And then the big item that we're asking for our special projects and carryover designation is the rodent abatement and prevention project. So that's our big dollar item this year. We're asking for $250,000 to get a collaborated program up together. So we'd like to be working with our community partners, exploring what options are available for rodent abatement, and what's our role, what's the role of the cities, what's the role of the counties. Curtis and his team will be working to put together a comprehensive program, and deciding how that would roll out in the community and what we can actually do to start to take care of a problem that we're hearing a lot about. Last item's really small. Moving we have an old Connex train card type storage out there with a door that doesn't work on it. We'd like to trash that and get a new small storage container out there for our products that we have stashed all over the building inside right now. So that brings us to a total special projects carryover designation of 1.1 million. And once we take out those other reserve fund designations, that would leave us an undesignated available cash balance of $97,000, so just under $100,000. That is the summary. This is an action item, so do any questions that you have, and then I'd ask for a motion from the board to approve it.
Well, I think my question is gonna be, how did we arrive at the 250,000? What is that bias? What, are we kind of spitballing a number?
Yes. The simple answer to that question is yes. We don't know exactly what the program is going to include yet. I know both Kristen and Curtis have been looking at what other states who have been successful at this have been doing. But the number itself is a spitball amount based on what we had available. And I think we've preliminarily heard that cities and maybe counties too will be interested in not contributing to us as an agency, but contributing their own activities or resources in a way. We'll be doing the collaboration to bring people together and making sure that the efforts are directed the right directions, and they'll be bringing resources. Yeah, coordinated, directed the right directions. Coordinated is a much more concise way to say that.
Wonder, my thought or concern might be if we, appropriate or allow that much money up front, does it open the door to find a way to use it? And maybe would it be prudent to incrementally fund a program once we have Curtis's structure or, a structure of a program, so we know what we're putting the money towards in maybe a little more detail. I don't know what
That's what I was thinking. Is this gonna be an ongoing expense? Track control, 250,000 every year,
So from the perspective of the carryover designation, if we do less, then it goes into that undesignated available cash balance. So whether we set it aside at the beginning and need less, or don't set enough aside and then we don't ask for more until January, it's not materially going to make much of a difference, except that there's more available to start with if we designate it now. So it's totally up to the board which way we do it. I'll be providing at least a report of what the balance is every single board meeting. And I would guess Curtis and Kristen would be providing the details of that program structure as frequently as the board would like. My preference from the financial perspective is I'd rather have the money designated to a project than undesignated. And if we don't spend that at both budget revision and year end next year, we can decide what to do with it. It just, from the financial perspective, it's a little cleaner to have it in a spot than not in a spot.
So as we work towards a program, we can approve parts of the program, or we'll take this aspect of it that requires this amount of money, and maybe this isn't something we'll emphasize and not use resources towards that part of the program, or
Yes.
so we can control as we go once we see a game plan.
I feel comfortable doing it ahead, just so that you know what you've got to work with, and you've been really good about reporting where you are and with what you've done with what we've appropriated, so that would be Brooke.
All right. Any other questions, thoughts online? Commissioner Caldwell, are you okay? Right. Well, then we have this proposal before us. And I guess we're open to a motion regarding this proposal.
I move that we accept the carryover and reserve fund proposal.
I will second that motion.
Okay. We have a motion before us. Is there any discussion regarding the motion? Other discussion? All right, seeing none, then all in favor of the carryover and reserve fund proposal as presented, say aye.
Aye.
Aye. Any opposed? All right, motion carries. So, Laurel's up. All right, now we're moving on to further discussion about Kratom. So Becca is.
I just want to start by saying I appreciate our public comments today, because a lot of what we are going to talk about today is the differentiation between what's happened in the past and sort of what's happened in the last couple of years with Kratom and why it's like that. So thank you so much for being here. Just want to do just a general introduction and kind of education for anybody who might not even know what Kratom is. But our commenters did a fantastic job. I probably just could have handed you some slides and had you do it for me, but so it is a tropical plant. It's native to Southeast Asia. Traditionally, it was chewed, and it was usually used It can be used as a stimulant or as a like a sedative, depending on the dosage. But typically, Southeast Asian workers would use it, chew it in their lip, and it would help to give them energy. Now it's, put into pills and capsules and extracts and things like that. So it can provide temporary energy. Oh, sorry, Matt, can you go to the next slide? Thank you. Pain relief or relaxation, again, depending on the dosage. Some of the self-treatment uses for it were for coughing, suppressing diarrhea, using it for anxiety and depression. And then opioid use disorder, which was brought up by our other speaker during the opioid epidemic when that really started to rise, especially in Appalachia, and started moving this direction. It was sort of thought of as an off-ramp for opioids. I would say we could think of this parallelism between tobacco and vaping. Vaping was often recommended as a way to stop smoking traditional tobacco. And so sometimes kratom was recommended. The problem is that the synthetics came onto the market after the fact. So, and as mentioned before too, it's just sold in gas stations, vape shops, online, can kind of get it anywhere. Next slide, please. I should have written on here potential effects because it's obviously these effects don't happen to everybody, just as I feel like I'm reading from a pharmaceutical commercial right here, but there's a whole slew of things that could potentially happen. Again, probably depending on dosage. Like if you were to start using it, use it maybe not too high of a dosage right away, it can certainly make you sick. There are some common side effects that are linked specifically to the whole leaf kratom product. So that would be the non-synthetic, just natural chewing the leaf. Those are here in asterisk. I find it ironic that some of the things that people use to self-treat are also some of the common side effects. So, this is anything. But I won't read the list, but this is, and it's not exhaustive, but these are some of the most common side effects that people have experienced or reported. So as noted, 7-OH kind of came onto the market here just in the last like 3 to 4 years or so. The effective ingredient in kratom, the whole leaf plant, is what's called a partial agonist. But 7-OH, which is the synthetic, is a full agonist. So if you think of the opioid receptors on your brain like a little cup, a partial agonist means it's only going to partially bond, and a full agonist means it's going to fill the cup completely. We use this example a lot when we're talking about naloxone and how Narcan or naloxone works. It's kind of like an ice cream scoop. It'll kind of come in and take that out. So a partial agonist is, it gives sort of some opioid-like effects, but really we haven't seen a whole lot of complaints until just in the recent years about poisoning, overdose, and things like that. And it really is related mostly to that 7-OH. There's some, of course, but not all. So the 7-OH definitely has a greater receptor potency, about 10 times more than the traditional active ingredient. And then these are just, sorry, on the slide, there's some dosage sort of side effects from specific dosages. So these are people who have self-reported that they use regular kratom, and it's usually pretty low doses. And so 1 to 5 grams is more of a stimulant-like alertness. And then the higher you go, it becomes more sedative, and it can lead to respiratory depression. And I will say all kratom could potentially do this, but the 7-OH is certainly it's more related to a lot of these things that we're seeing. And this is just an example on the screen of some of the things that you can find in the gas station. These are like little shots, like they look like a 5-hour energy or something like that. You can just kind of take those. The other issue with the 7-OH that we're finding, we've talked about already, is just the lack of I think, transparency and regulation. So what's happening is people read the label, they think they're getting one thing, but it's actually totally not accurate. Again, another parallel to synthetic nicotine and vaping is that those things are not regulated. And so people think that it can work as an off-ramp of using traditional nicotine products. And it actually has higher nicotine in them and makes you more addicted. This can do the exact same thing. So it's not really an off-ramp from traditional opioid use disorder. It's actually creating a greater risk of higher addiction. Next slide, please. So we've heard anecdotally I've heard from some paramedics locally and police officers that they have used Narcan and naloxone to reverse kratom overdose. Again, there's that partial agonist versus the full agonist. So it really just depends on what type of product they might have taken, and also if they've taken it with other substances. So the research is still limited about the effectiveness of Narcan on it, but anecdotally, I've heard from local law enforcement that they have used it successfully, been able to transport somebody to the ED to seek further treatment. The signs and symptoms of an overdose from any sort of kratom product it looks very similar to a traditional, what you call traditional opioid overdose. So Narcan would be the first kind of line of duty to try to prevent that, but it's certainly not going to hurt you if that is not what they've taken. But it has worked. And then, of course, as with any other substances, using alcohol, other opioids, benzodiazepines, and any sort of over-the-counter medication can certainly increase your risk of overdose and death. Again, like the pharmaceuticals, always. So effective treatment to kind of come off of these substances is medication for opioid use disorder. Again, because it does bond to the brain as an opioid does. And so you can, with the guidance of a physician and somebody who specializes in that, take medications to eventually wean off of an opioid or off the kratom. And it'll help with the withdrawal symptoms. This is just some national data, and I do want to reiterate what sorry if I can't remember if it was you or the other speaker, but they don't differentiate in a lot of these phone calls between kratom, like full leaf, whole pure kratom, and 7-OH. So these cases, it could be a mix. They've only just recently started differentiating between the two when somebody might be going to hospital or if they self-report. So these numbers could be a mix of both, or it could be one or the other. So just preface with that. But an estimated 1.7 million Americans between 12 or older than 12 used kratom in 2021. That's based on a national survey of drug use through the Substance Abuse and Mental Health Services Administration. Another survey in 2019, they did find a link associated with past 12-month use of kratom and using cigarettes and cannabis. So they were 2.5 times more likely, which is not totally rare. There a lot of times somebody doesn't choose just one substance. It's usually multi-substance or polysubstance use. And then the National Poison System between 2011 and 2017 reported exposure. Almost 85% were between 17 and 19 years old. And then next slide, please. I have some Idaho specific data, and this data comes from the Idaho Office of Drug Policy. It comes from our hospital syndromic surveillance system. And again, we've did a kratom / 7-OH because these are pretty lumped together right now in terms of reporting. I'm hoping that with further conversation, there will be better questions asked in EDs or in the home from first responders to kind of differentiate between these two things. But there were we have the results from 75,000 urine drug test specimens over a decade, and about 1,500 were kratom positive. Again, unsure if that's kratom, for 7-OH. Lots of exposures and increases to the Poison Control Center calls. And then PD visits between 2022 and 2025, 506. And then that number doubled from 2022 to 2024, so 110. And I would say that doubling, 2023 is sort of that marking line where 7-OH became really popularized and really well marketed. So it makes sense to me that we would see a steep increase between 2022 and 2024. There's an average in 2025 of 18 ER visits per month. And then most patients that were seen were males, 71% were males, and between the ages of 25 and 44. Next slide, please. So we heard a little bit about some regulations, and in the state of Idaho, it's recommended that they be between 18 and 21, and many individual sellers can choose their age. So as the other gentleman noted, that they don't sell to anybody under 21. But that's not in, you have to be 18 to 21 to go into a Kratom shop, I should say. And then it's kind of up to them to decide what age is appropriate for them to sell it to. Currently, it's not banned in any US sports, although opioids and other things are. The FDA has recommended to have 7-OH as a controlled substance, and as of 2025, August 2025, the DEA also made a special, what's the word you want to call it? Basically making it a temporarily scheduled. So they're still looking at other Kratom products, but 7-OH, they do have right now at least some sort of temporary schedule as they continue to do research. So they are doing the research and working in that direction, especially on the synthetic. It's not lawfully marketed as a dietary supplement, food additive, or any sort of conventional food. And then banned in 7 states, although we did hear today that with some of those changes and that temporary DEA scheduling, Rhode Island has been one of those that has decided to reverse that because they were able to regulate the 7-OH, which is more dangerous versus the other. That was pretty recent, so sorry, that's old data. Next slide, please. So we've kind of already talked about like why now are we hearing about this so much? These are just some local news stories and legislation that we're talking about it, and it really is that introduction of the synthetic 7-OH. So again, that parallel between vaping, traditional tobacco versus vaping, it's just not regulated enough. We really don't know what's in it. There are no regulations to say what should be on the package. So we've heard stories, again, these are all anecdotal of, young adults who are thinking that they're taking a Kratom product for depression or anxiety. They actually get the synthetic and the dosage is much higher, and they have died of an overdose, or they've, taken themselves, have had to go to the hospital for an overdose, which was luckily reversed. The timeline of Kratom coming into the United States, it's been here for a really long time. So it really came to the United States most popularly after the Vietnam War, because soldiers were returning home and bringing it back with them from Southeast Asia. So it's kind of been under the radar for a really long time. And I think the opioid epidemic is really what kind of brought it to the forefront, just with the conversations and recommendations to use that in order to go off of opioids. And also during the opioid epidemic, there were more regulations on prescribing and things like that. And so it was harder for people to find opioids if they were already heavily addicted to them. And this was an alternative that would be probably a better substitute than moving to heroin or using injectable drugs or things like that. Because it is, pill powder form, a little bit easier to take in. So, I'm sure you all know, we've had a couple of years worth of lawmakers trying to regulate different products. So far it hasn't been successful, but I do think that it's gonna be continued conversation in this coming up legislative session as well. And we've started including kratom information in some of our parent presentations, just so parents really know what to look out for. It's really part of our drug overdose prevention program, and Courtney Boyce, who you've all met, our opioid settlement strategist. She really is an expert in this area, and she's been doing a lot of community presentations to just really help people understand the differences and why it's so important for regulation, so you can be an informed consumer, as our other guest stated, so. That's it for me. Any questions?
Yes. So have you
Yes.
heard, are there any circumstances where either the natural or the 7-OH or dosages or circumstances that lead to impairment? Driving impairment or?
I think, yeah, so I think what that would really depend on the dosage. So, and I think probably tolerance. Just like if I were to go and have a knee surgery and be prescribed an opioid pain medication pill, if you've already done that before, you've had multiple surgeries, you might be able to drive on that. I know I can't because I just want to take a nap. So I think it would probably be most parallel to that sort of situation. I would say dosage, but I haven't heard of any anecdotally of an increase of people getting pulled over by the police and being under the influence of kratom, unlike alcohol.
Or employers testing for it that have to operate equipment or?
I have not heard of that coming out yet either. No, I don't. As far as I know, that is, so it would show up as an opioid on a panel drug screen, but it probably depends on how many panel drug screens. So there are some drug screens that are like 11 panels and there's some that are 25. So it really depends on how intricately you can test, but I haven't heard of any employers who are actively seeking to ban that on their screens or looking for that.
Dr. Cole? Do you have any thoughts or experience with that or testing? Anybody else? Questions? Well then, very good. Thank you. Right. Well, is anybody in need of a break or charge forward? Keep rolling? All right, very good. All right, Sierra's up. We're gonna talk about nutrition education.
Thanks for having me today. My name's Sierra Rodriguez. I'm with our risk reduction program team here at the Field of Adults. We just heard from Becca. She manages our larger health policy and promotion team, and then my little risk reduction team is a smaller subsection of that larger health policy and promotion team. I'll wait for the slides to come up. Okay, you guys have access to that. Next slide, thanks. So I wanted to take a second just to introduce my team as a whole and kind of provide some context to why we moved in the direction of hiring a nutrition coordinator. So you guys have heard from Katie before. She's our youth vaping prevention coordinator. We've got Mindy who does vaping and nicotine cessation, and also runs our two county health coalitions in Boise and Elmore County. Mike Rice is our resident kind of senior exercise and all things older adult health fit group coordinator. Alex runs our chronic disease prevention. He primarily does community health screening, so assessing individuals' risk of diabetes, cholesterol, blood pressure in community settings where people might not otherwise have access to healthcare. And really, nutrition, in my opinion, is foundational to health. So we were kind of missing that piece. Across the sectors that Alex, Mike, even Katie and Mindy work in, know that nutrition plays such a huge role in living a healthy life. And so since I started in this role 2 years ago, like we've really been looking for the funding to kind of expand that work with this idea that investing in nutrition would help, again, prevent disease before it happens. Really advancing our vision of healthy people and healthy communities, and just strengthening our role as kind of a trusted advisor and source of reliable health information in our communities. So in January, we made the case and we brought Heather on. She's here with us today in February. So we're really just hit the 6-month mark of her in this position. And so I'm just here to talk a little bit about what we've done and achieved so far in that 6 months. She has been a wonderful addition to the team and has really blown away where I thought we would be at this point. So we'll just talk a little bit about the things we've done so far. Go ahead and go to the next slide. So one of the biggest efforts that we have been able to achieve since Heather started has been food rescue in partnership with Rolling Tomato. Rolling Tomato is a local nonprofit. They're based out of Nampa, but they serve several of the counties that we work in, including Valley, Elmore, and Ada. And they are mostly volunteer run, and they pick up local produce and food that would otherwise go to waste and deliver it to numerous sites across our footprint, some of which include local housing, low income housing units, other nonprofits that use the food and whatnot. So one of the ways that we have partnered with them is by funding their sites. They have a $1,000 site fee, which I would say is pretty minimal to bring food to so many folks in the area. Heather has been responsible for taking food out to Falcons Landing, which is the low-income housing unit in Mountain Home. We started those in the beginning of March. There's been 23 deliveries now, if we include this week, 47 families served and 609 individuals served. Over 50%, we're reaching over 50% of the residents. So you'll see some pictures here on the slides of what that pantry looks like, and it's primarily produce. We did shift, so in March when we started, Heather was actually going with the Explorer and loading thousands of pounds of produce and hauling it out to Mountain Home from Charlie's Produce. And we've since shifted, and Natural Grocers and Boise Co-op is actually bringing food here, and we're then delivering it out to patrons at Falcons Landing. We are also funding Ada out in Mountain Home. They're getting weekly deliveries. That's been a newer initiative. They've had 13 deliveries thus far, and they're serving about 100 individuals per week with fresh produce. We've also funded Sunday Distro Boise Kitchen Collective, who are doing food meals at Rhodes Park weekly. And since June, Heather has hauled over 2,000 pounds since we made the transition to Boise Co-op and Natural Whole Foods out to Falcons Landing. And sometimes when there's extras, food even comes here to CDH for staff to enjoy, and we've had over 1,000 pounds, everything from strawberries and bread. So staff have coined Heather as the bread lady. So Mondays are a busy day for her. Definitely she's getting her physical exercise in as well. And then, so that talks a little bit about our food rescue. We go ahead and go to the next slide. We've also had the opportunity to support some community gardens. So Horseshoe Bend School District, we were able to put a sub-grant in place with them to revitalize their school garden space, which they're actively doing with plans to use it in the next school year, which is starting probably any day now. Um, they had their shop students actually build their raised gardening beds. They had school members kind of dig up and reuse the space. Heather and I were able to go out with them to kind of look and assess, provide recommendations on best practices, and really talk about how to implement education alongside the growing piece. So how do we get young people involved in growing their own food, preparing their own food, and knowing the nutritional value of it so that they can make healthy choices. They will be implementing a gardening club as well this school year. So they have essentially with kind of like an advisory period where students get to sign up for different clubs and activities. And so they'll be doing some growing related activities in their gardening club. And Heather's able to provide technical assistance and some of the planning that goes along with that. Idaho City, we've also helped organize a coalition. Some of the members on that coalition, that's for our Parks and Rec, the Historical Society, Idaho State University Master Gardener is participating, City Council, as well as us kind of leading the charge. They've identified a site to have a community garden and they're planning to build in 2027. There's some water issues that they're working through. So that's great in Idaho City. And then in Mountain Home, El Ada also has a community garden, and that's the picture that you're seeing here. They needed some assistance, kind of just revitalizing signage, making sure that people are aware that it exists. So we've stepped in and helped do doing that. And then they're also partnering with veteran nonprofits that are taking veterans out and talking about the connection between mental health and gardening. So really cool avenues that we've been able to kind of intertwine some of the other programming that we do as well. Next slide, please. Another large component of our program is nutrition education. So prior to bringing Heather on, we had started to dabble in the nutrition space. We had actually been awarded a grant from Pacific Source to do Cooking Matters, which is a program that the Idaho Food Bank helps us run. And Alex had been doing that specifically in Elmore County. So the numbers you'll see here, these 15 classes, hasn't just been since February. That's been since last year in fiscal year 26. And Alex was running those, but Cooking Matters, we partner with the Idaho Food Bank. They actually provide gift cards for us to purchase the food. And then we teach the class. So that's a really great example of collaboration where we're helping each other further our missions and goals because the Idaho Food Bank has one staff member dedicated. So as you can imagine, they don't have the capacity to teach these classes. So our staff, Heather, Alex, who teaches our chronic disease health screenings, and Mindy, who runs our health coalitions, have been able to take these into Ada, Elmore, and Boise counties. We're really excited to expand to Valley County with bringing Heather on this year. And those classes are 6 sessions. There is a adult curriculum, a family curriculum, and a teen curriculum. The teen curriculum's fun. It's kind of got like a built-in challenge. So at the end of the 6 weeks, they get to make their own recipe and have kind of like a cook-off. They are typically about an hour to 2 hours long. They actually prepare a meal together and eat together. And then there's a lesson that goes with each plan, with each class. So everything from how do you read a food label? Why should we watch salt intake? How do you go to the grocery store on the budget? Is kind of covered. It's really fun. We have really great retention for those classes. I think sometimes, unfortunately, due to the nature of our work, it's sometimes a little mundane to folks. So it's hard to always get people in the door and have them stay the entire time. But with these cooking classes, we see really great retention. People come for all 6 classes. Again, they get food, which is always a great driver. So we've done 15 classes thus far with more planned. And typically those range from 10 to 15 participants. We've also implemented youth garden activity kits. So we purchased supplies to have 60 kits, 15 were distributed to families and students in Horseshoe Bend, and the rest are going to go up on our storefront. We've also partnered with West Bench Farmers Market. So you'll see a picture here of the table. And Heather's been coordinating a community cookbook. So at the farmers market, we're providing education, talking with folks about their nutritional goals, having them submit their own recipes to essentially compile a community cookbook to give back. Let's see. We also have nutrition education presentations available. So we kind of coin those like nutrition 101. It's really the basics. What is nutrition? What does that mean for folks? How can they make healthy choices at the store, eating out, cooking at home for themselves and their families? So we've done 2 of those presentations here locally within the past 6 months. We did a CDH family night, which is part of a larger initiative to help bring in clinic families into the building to know more about what we do. So we've done a vaping presentation for families. We've done nutrition, and we'll actually be doing a presentation about Kratom for families next quarter. And then Heather was also able to present to our Fit Fall Proof exercise leaders. So Mike's Fit Fall Proof classes, we've got over 100 volunteers that run those classes across our footprint. And we always are trying to not only build their skill set as Fit Fall Proof exercise coordinators, but other things that are in their wheelhouse. So Heather was able to put together a presentation about the importance of protein for seniors. And then also this summer, something exciting that we had the opportunity to do was partner with Hub 365 to do some youth nutrition activities across some of their housing units. So we were able to work with an intern. We did a rethink your drink exercise and then 2 lessons on grapes and fruits. So kids were able to come while they were out of school, have a snack, and get some education while they were at it. Okay, next slide, please. We've achieved a lot in 6 months, but we've got lots of other things planned. One thing that I'm super excited about is our Bridge Bag program, which has been in collaboration with Family Clinic Services. So St. Luke's has a really nice model that they've used where sometimes they'll have individuals come in, clients that they're seeing in clinic who have an emergent food need. And they will actually provide them with this like a 3 to 4 day supply of food for their family while they wait to get connected with long-term food support, such as a food pantry. So we are replicating that program here based on some of the work that they've done at St. Luke's, so that when we have clients who come in to the clinic, if they screen positive, so we screen with an SDOH tool at our clinic, if they screen positive for food insecurity, they can be given a supply of food. We'll use our internal referrals resource that we already have in place for our CHW to further connect them to additional resources. And so in the bag, there will be food as well as like some paper resources, a food resource card, some information about our community closet, our nutrition class, cooking classes that we have available. And then within a certain, probably a 3 day period, our CHW will follow up with them to make sure that they were connected to long-term food support. And those are really meant to be like a one-time emergency, help them get on their feet. We're looking forward to expanding Cooking Matters to all counties that we serve. So getting up to Valley County, potentially like getting some volunteers to assist with the implementation of that. We've had really great love doing that in Elmore County via the coalition. So Mindy has rallied the Elmore County Health Coalition. They actually have a nutrition subcommittee. And so the folks out there have actually been trained to also teach this class. So the community health worker at Desert Sage, as well as some of our other partners, will assist in implementation in Elmore County. So I'm hopeful that we can replicate that in Valley and potentially Boise County to expand our reach, because obviously Heather can't be in 3 places at once. We also plan to make our nutrition materials available on our storefront. So I brought some of our materials that we have with us. We've got some gardening journals that went in with those gardening kits, and those will be made on the storefront. Some nutrition, just general information and materials about our programs, so that people can order that via the storefront. They are planning to host an open house and garden cleanup at the Mountain Home Community Garden, and then we're also planning further nutrition presentations to expand that reach, including working with our parents as teacher staff on a picky eaters presentation. That's just some of the things on the horizon. And that's it for me. Questions?
Back at the bridge bag bullet point, what is that screening? Like you said, there's a screening.
So all patients who come into our clinic or even WIC and a PPAT, they utilize an SDOH screening tool. And it's a series of questions that really gets at any additional needs that folks might need. In regards to food insecurity, it asks 2 questions, which is in the past It's on the front. Yeah, me either off the top of my head. It's like within the past 3 months, have you been unable to access food? And then are you concerned that you wouldn't be able to access food?
Well, this is the kind of stuff I don't find mundane, but
Aim to please.
yes. You know, the locally grown produce, and that sort of stuff, that emphasis, there's absolutely no doubt that that is, you know, like locally grown tomatoes have much more food value and nutritional value than tomatoes that are picked in southern Mexico and trucked 2,000 miles and that sort of thing. So that emphasis is something that I really appreciate. And, you know, having, you know, some skin in the game, you know, community gardens and, you know, teaching kids to, and the importance of where their food comes from and how to get it on their own, things like that. I think is really good.
Yeah, I think food is fun. And there's such a great opportunity there to educate about, again, like how to grow it, how to prepare it, how to eat it. And I'm excited for CDH to kind of step into this role and be known as a partner in this work. Um, historically, we haven't, right? We talk about preventing disease, but I think this really moves upstream and allows us to hopefully get at the root cause of some of these issues so that when Alex is doing health screenings in 20 years, if we can keep him that long, we're seeing less high blood pressure, high cholesterol, diabetes. And I'm excited for us to continue work in this space. Heather was recently asked, the city of Boise is putting together kind of a food action roadmap, and we were asked as a partner to provide input. And so just knowing that within 6 months now the city is recognizing us as a player in this field, I think is really exciting, and I hope that we can continue to show up as a partner in this work.
Dr. Cole.
Thank you. Thanks to having me.
Well, and one of my favorite classes in high school, besides physics, of course, was advanced foods, where we got to actually cook. And the good part about that is after the cooking came the eating. So you could eat that 10-pound pizza you just made. Any other thoughts on this subject? Very good, thank you. Well, and so we have a vacant trustee and executive council member position. Now, which one of you is thrilled and excited to accept that coronation? Did we not have like a joint one last time?
Cole is the.
So Dr. Cole's kind of the joint one. Or he's half the trustee right now. So I don't know where we are with filling the other half of the position. But any thoughts on that, Dr. Cole? Catlin, do I sense this urgency to to participate in that? Okay.
Choice, no.
Well, then, that settles it, no choice.
Mr. Chair, do we have to fill this right now? Wait till the new board member is.
Yeah, and that's
I mean,
something,
I don't know if we want.
that's something that I thought about, but tasking the newest board member with that, I don't know, might be.
I would do it, but just like everybody, we are busy and responsibility.
I mean, we could. It's not active committee right now, I don't think particularly. We could sideline this for a little bit until Commissioner Caldwell figures out her situation. Yeah, but you'll be a veteran here in what? So, am I hearing a
We're waiting to hear from the counties, on their approval, but a new board member has been selected by Elmer County and is going through the approval process from the other counties. So hopefully,
so maybe we sideline this till next meeting? Okay, so do we have a motion then to sideline picking the other half of the position?
Yeah, I'll move that we postpone this decision on the vacant trustee and executive council position till next meeting.
Any discussion on the motion? No one wants to argue about it. Seeing none, all in favor, say aye.
Aye.
Aye. Any opposed? All right, very good. We'll procrastinate a month. All right, next is a conversation about a resolution that was presented in our packet. And Director Ryan is going to present that.
and to clarify, there are you received two resolutions. So today we'll be talking, well, I'll talk about both, but first let's talk about the resolution to clarify Idaho Code 56-203. It's very short. It deals with the lawful presence legislation passed. We, with legal advice, have decided that applies to everything we do, that we need to verify legal presence before we provide the service. I believe the intent was, or usually probably financial, benefits or like WIC or something that was more relevant to receiving funds. But we've applied it even to our land-based applications, our septic system requests, our food service establishments, if they come to us. We have a process now where we ask them to verify their lawful presence before we would give them their food safety permit, for example. I think that that's overburdensome and unnecessary. We're pretty far down the stream when it comes to governments that they interact with in both of those scenarios. By the point that they get to us, I would assume there's already been checks on if they can legally do what they're doing. So we would like a resolution. We are proposing this resolution to request clarification from the legislature that they did not intend lawful presence to be verified in those scenarios. Other health districts are also expressing frustration with us. There's been a couple situations where permits have not been granted in other districts because someone just didn't finish the step. It wasn't that they didn't have legal reason to do it. They just didn't get the paperwork in and then were unable to do their events, which was controversial. So there is legislators already interested in solving this problem, and I have spoken with Representative Healy in particular, who's wanting to fix this. So I don't think this is controversial at all. We're just trying to fix a bureaucratic problem. Any questions about it?
Was it published?
It's a packet.
It was published in our packet, so I believe it is visible. The other resolution I'll talk about was not in our packets or published, so that one would be something we wouldn't be voting on today. It's more informative.
But I think you make a good point that maybe, on the actual agenda, describing it a little bit, like a resolution regarding X, Y, Z. And be a little more clarity for people.
Yeah.
Looking at it. Future, any. Okay. Here we are again. Any thoughts or anybody want to make a motion regarding this resolution? To clarify.
Anybody have any issues with this resolution the way it's written? I don't necessarily have any issues with the resolution the way that it's written.
Online, either of you have any issues or comments on the resolution itself? Okay, then I guess we're back to, do we have a motion to dispose of this or do something with it one way or another? We want to send it forward?
I think I do. Yeah, so I will make a motion to advance this resolution for consideration at the Idaho Association of Local Boards of Health annual meeting.
Well stated.
Thank you.
Second? Anybody?
Yep, second.
All right, so we have a motion before us. Any discussion on the motion? Hearing none, all in favor of the motion to advance this, signify by saying aye.
Aye.
Aye. Any opposed? Very good. Another motion nailed down.
If I may, Mr. Chairman, so the Kratom resolution was also sent to you, not in our packet necessarily. It is not our resolution as in District 3, or District 4, District 3. It is District 3's resolution. They're working on that one. And it's in relation to Kratom. And they're still working out the fine language, so that isn't the final version of it, but that is just wanting your awareness of it because I believe it will go to the board that they're proposing. So that's the point of that.
Well, very good. Then we're moving along. Next up is directors report.
Okay. And I know I'm between you and the bathroom, so I'll probably be quick. I want to, my first board meeting, thank you for having me. It's been really an enjoyable experience onboarding at Central District Health. I've been able to meet lots of amazing staff. We do really powerful work that warms my heart and makes it easy for me to advocate for what we do. Excited to be in this position and I have such a great team to support me and work with me. So I can't say enough good things about the organizations, the health, financially, and just structurally, everything's really wonderful. So that's my overarching comment, but I wanted to use my time to highlight just to me what I see as the most important work we're doing in each county. Because to me, that's, it's critical that we support every county in the way that they need supports, and every county is a little different in what they need and where resources, I think our resources should go. So starting with Elmore County, I know we don't have representation from Elmore County today, but the CAMS program in particular has been what that community requested. That's a program where we go out and provide support to the EMT system, to provide preventative care, trying to reduce those frequent flyers on the 911 system, which is burdensome to our limited emergency response community. So we've been able to reduce the amount of calls they get from people that maybe it's not a full-on, it's an emergency to them, but it may not necessarily qualify as what we would consider a medical emergency. And by having these individuals focused on helping people with medication or mental health issues and getting them connected to the resources they need so they don't have to call and have an ambulance come out to check on them. It's been really helpful for that community, and we've seen a real positive improvement in the system as a result. In fact, we're wanting to replicate that in our other counties as well. It seems to be working really well there. I think there's a whole nother layer of that, which we're just starting to explore. District 3 is really interested in their more rural counties of providing the layer lower than EMT support, just more like a clinic, more community aid help where, you know, elderly people who want to stay at home. I know my parents have chosen that path rather than going into a residential facility. Sometimes they need help, but they don't need EMT help, but they need somebody to make sure their refrigerator is working or that they have their meds correct or who knows what, that they have a handrail on their steps so they don't fall again. And so there may be in the future an opportunity to even expand camps in our areas to go to that level of helping people with what they need and not be limited to the more medical aspects of it. So wanted to highlight that for Elmore County because that's working really well there. In Valley County, we finally have a new environmental health specialist to work on septic systems and land-based inspections and our food service establishments, which is a really wonderful thing for our organization because our staff have been having to travel up there. We're spending a lot of, I think, Russ used the term windshield time to support that community, those communities to meet that service. So I'm so glad that we have a gentleman by the name of Luke. What is his last name, Curtis? Say it again.
Luke May
Okay, so that's our new position that starts next week.
starts on Monday.
Monday up there. So we're really, that was a very difficult hire. We've been struggling to fill that position in on-call because of the cost of living. It's just higher up there than it is in our other areas. So we have decided to increase the pay a little bit for our staff that live up there to try to offset some of those cost of living, to own a home or rent in that community. So excited about changes that are happening there. Also trying to expand our CHEMS program into the Valley County, which is also to support the EMT activities happening there. Boise County, it's our clinic. That's where we're really leaning in. I think it's seen a lot of success. But it's been a little bit harder to get integrated in that community and build that trust so that people will come to our clinic and receive the services. They're well child checks, but from the dedication best team, it's slowly been building to showing up at the same time every month. We're starting to see individuals returning. And we're hearing stories about how people have appreciated the non-judgmental approach that we've taken to vaccinations, for example, so that they don't feel shame in bringing their child in for their well baby checkup. So that's really important for us to, to meet them where they are and provide those services we know are so essential. So really grateful that we're starting to see that pay dividends and we're starting to see repeat customers and helping people get those well child checkups that we think are really important to catch things early. So that's been really positive and we're excited to see that continue. And then Ada County, it's the RAT program, and we tried to come up with a really catchy acronym that said RAT because that would have been more fun, but we struggled to get the right words to do RAT, so we're doing RAP. But there's just a real need in Ada County for somebody to convene all the players that want to address that problem. We are not going to be out applying rodenticides and going on people's private property, but if we can convene all the partners that want to do something about that, I think it will, we're hearing a lot of people very excited that we're willing to take that role on, working with Ada County, but they have some limitations legally, whereas we have some unique authority to abate nuisances. We really want to be on the positive side of this equation. I'm not seeing this as an enforcement program. This isn't something where we're going to go out and force people to do things. We want to be providing free traps, education, working with public landowners to hire private contractors to perhaps deal with infestations on their property, like maybe Albertson Park, which I keep hearing about, has infestations on the hillside. That's impacting bench residents. So it's fun. I think it's kind of interesting to provide a service to a community that they really want, instead of us telling people what they should do. So I think it's just, we want to kind of dip our toe in this and see where it goes, but there's real need in Ada County for some work on coordination of efforts to address this problem. District 3 is excited. There's a lot of other communities that want to be a little more in front of this and try to prevent the problem from spreading. So we're setting the groundwork for them to step in and where they need to step in. That's our plan for Ada County. And then finally, my last thing would be Excella. I'm very excited about the Excella implementation. That's a state that's going to impact our district across the board. Not every county will benefit from that. It'll allow our customers to access their information without having to call. They will be able to pay online. It will prompt them through what they need to provide us for their permit. We have a lot of incomplete applications because our process is confusing and people don't often give us what we need, which requires a lot of back and forth and frustration on their part. We need to improve that process. And this tool is allowing us to do that. It's allowing us to create an interface where we can ask people the right questions, and so we can hopefully get them through our process quicker and less painful. So excited to see that launch and the benefits that will hopefully improve our relationships with those customers. And that's my report. Any questions?
Very good. Thank you. All right. The next thing on the agenda is something we adopted a little bit ago, kind of just a general few-minute discussion on something current news in health, public health. Now, I didn't bring anything specific this month. Did anybody else, or Dr. Cole, have you run across anything somewhere around the world that you've seen? Yeah, current topic in public health. Very good. Thank you for that. Does anybody else have a subject?
That's what I was gonna bring up
Yeah.
now.
So for us, I think, yeah, we started to cover it, locally here. It's rats and of course the kratom issues becoming, more known about and so forth. And so I think we're on the right track investigating these things. We'll see what Curtis's team comes up with here. Hopefully for next meeting, to have a, relatively solid proposal game plan on what to do about the rats. Besides giving each of the county commissioners a flute and
We have lots of fun
doing the
ideas.
Piper thing. But we'll see if we can expand beyond that. So that being the end of public health discussion, anybody else have any other comments? Otherwise, I think we are going to adjourn.
I'm gonna go order $250,000 worth of flutes.
Yes.
No, serious. I really want those.
Flutes and terrier.
Flutes and terriers.
Oh my gosh, it would be the cutest thing.
I've seen some of the videos of those dogs.
Yeah, when they like pull up the farm, or they're like working on wood, and yeah, and there's like four.
Yeah, or roll back the dumpster and the dogs are
On it.
And that's-
Rat terriers,
on
that's what
it.
they were bred for, is to kill rats.
Oh, yeah.
Communities that are trying them, so there's all sorts of interesting methods to address it.
No, these dogs, it's sort of like
Animatronic changes.
and different things like that. Geez, these dogs, they showed a video of it, like,
Yes.
and they just,
A clock. It's like a mouse trap.
Yeah.
Like flame.
they
I want to kennel.
go to town
I was thinking
on
of
those
these.
on those rats.
No, I don't think we'll do that, but it's fun to think. I think we should do the bounty. Like the
Yeah.
pythons.
So for a while.